So for frictions of the medial ligament goes from the femoral condyle here down towards the tibial condyle on the medial side here and goes up the inside. So very similar to other ligaments. You're just going to friction across it. You've got to be a little bit careful when if you've had massage or there's oil on the skin or there's lotions on the skin, because you don't want to do is just be rubbing over the skin, because what you'll do is you'll cause a blister. So when you do friction massage, you want to try and make sure you're moving with the skin, you're not moving over the skin, otherwise, as I said, you will cause a blister. So I'm just frictioning where the middle of the ligament is here with one finger across the ligament. I'm trying to bring those fibres and line them up that way, so therefore I go across them to kind of bring them all together and to try and line them up. And again, I don't push too hard, but I'm just trying to push to try and spark off a healing response and to try and line those fibres up as it heals. I'm going to wait for it to start to bed down as it starts to scar down. However, you can start this a little bit earlier, as long as you don't push too hard, as long as you're pushing quite gentle and all you're trying to do is line up that nice immature scar tissue. Good, grade 1, grade 2, grade 1 injuries, you've probably got to live 4 or 5 days before you start frictioning it. Grade 2 injuries, probably more likely 7 to 10 days at least before you start frictioning it. And start off very, very gently. Only do it for a maximum of a couple of minutes and get what the patient feels and how it feels to them. If they get much of a reaction to it and it's very sore, then you've obviously done it a little bit too hard and you need to just come back off it. As long as you don't get a reaction, then you can carry on doing this on a daily basis, just once a day, just to get that, as I say, to encourage the healing of the ligament. All friction massage, you need to be quite cautious. My belief is don't go too hard, just go nice and gently into it, and just all you're trying to do is to get it to encourage healing more than anything. Because if you do it too hard, you'll just break the scar tissue and break that kind of healing that that has formed and has started. The other real advantage of friction massage, very similar to normal massage, is you do it very late on, where maybe the ligament's got stuck down a little bit, and what we call adhesions, where it sticks itself down to the bone. So therefore, this is quite useful for just freeing that up. And what you will notice, especially in late stage rehab, is that when you friction it, afterwards it feels really good, because the kind of movement gets freed up. And that's when I tend to use frictions a lot more, is in that later stages.